We have a pediatric dental specialty office and a board-certified pediatric dentist. Our practice sees only children and special needs adults.
So you get 45, 50 kids a day, you said?
Yeah.
What age range?
Anywhere from a few days old, in the rare case, all the way up to, typically we transition kids over to a general practice around the late teens, maybe 18 or so, dependent on their needs. We do have, like I mentioned, some special needs population that's much older.
I'm fascinated by that.
Yeah.
Okay, let's talk about it. Well, what kind of, give me some classification.
Yeah, so the reality is most of the time we don't feel that there's a lot of training consistent with our special needs population, and having dentists being able to treat adults that have significant challenges. Therefore, a pediatric dentist, being that our training has taught us about a lot of this stuff, we are most apt to be able to cover it. In specifics to HealthyStart, we're actually seeing quite a few kids that are really not great orthodontic candidates in the traditional form of considering braces and things like that. And so therefore we're able to get them to start wearing these appliances either at sleep or in their occupational therapy sessions and achieve orthodontic results and straighter teeth and better breathing and all that other kind of stuff that comes along with it.
So the adults that have special needs, are we talking like autism, Down syndrome, that type of thing?
Autism, Down syndrome. Sometimes not even a really diagnosed condition, but they're in a specific home. They have some significant limitations as far as cognitive and behavioral issues. Some phobias. The reality is we are also going to have the ability to take children to the operating room for treatment, or adults for that matter. Sedation and things like that. We do a decent amount of that as well.
Well, the reason that I'm really caught my ear is because we're wanting to work with children who have autism, who have these things. And since you're working with adults, you're exposed to this. Does that give you a better equipped approach for children when they come in that have that?
Absolutely. Yeah, we're seeing probably my 5th case that I started with HealthyStart was on an autistic patient. One that had significant issues with sleep. He was up 8 to 10 times a night, couldn't sleep through the night at all. We put this thing in, and within 2 weeks he was sleeping through the night for the first time ever, and he's like 11. We also have a child with Down syndrome who I had just prior to this taken him to the operating room. Bilateral crossbite, meaning super narrow upper arch, could not breathe through his nose at all, which is typical of a presentation of Down syndrome patient. But we've since we started this and we got our impressions and we started our records, he's wearing his appliances. We did an expander for him in conjunction with this as well. Just totally different presentation of his arches. So it's great.
How resistant was he or compliant with you?
I think it really, so much of it, compliance depends so much on the entire family dynamic. And I think that one thing that we really took from our very first session here is that you have to take that into account. You have to build the relationship from the very start. You have to bring the family in for the appropriate consultation, make sure everybody's on board, and let them know that this only works if you wear it. So if you're not consistent with having the family support him in that, and they don't have the internal drive to do it, it's not going to work for any patient, period. You have to be able to wear it. And the nice thing for this particular patient that we're speaking of is he has, at school, his teachers have focused, one-on-one or 1 on 2 or 3 time to where he wears his appliance and just keeps it in that whole time. And he puts it in every single night before bed after brushing. Now, does it always stay in? Maybe not, but what we found is that they're finding that it takes longer now for it to fall out. Even though we're several months down the road, sometimes that happens. And but I'm seeing the changes, like amazing differences. So we feel like if you front load that initial attention and really set expectations as what they are, then people can make their own decision on whether or not they think it's going to work. If they don't feel like it's going to work, I'll be the first to tell them, maybe this is not a good choice for you to spend your money on.
So the young man who was getting out of bed at age 11, 8 to 10 times a night, you also mentioned that the family has to be involved, but the family's also impacted by the outcome.
Right.
So what was it like for that family when he started
Yeah.
sleeping through the night?
First time they came back, Mom was like blown away. She was like, well, because we don't always do this, but sometimes for our special need population we'll do this, where we basically said, hey, we're going to do it like a trial appliance. You know, pay a few $100s, we'll give you a trial appliance. If this works and we want to go ahead and bill for it, then we'll do that. It took seriously the first time, and they came back and they paid the money right after that. So she was ecstatic. She was like, I don't even know what to say. I had to have braces, Dad had to have braces, you know, he's not going to be able to do braces, he's so negative about everything, blah, 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 and then just total flip and switch with wearing this. And even the brother who, gosh, I think he's 6, not autistic, but at 6 years old, she's like, we need to get this on him. She's like, you know, he doesn't have the same symptoms, but we need to do it because we don't want to do the braces. So yeah, it changes their lives. They see the difference in their kids and what's going on with that. So
Some of the studies, I don't know exactly how they find these numbers, but they talk about the extended life you have by making these corrections. Somebody who has Downs, somebody who's autistic, I think they have a shorter lifespan to begin with. But the quality of their life going forward, what do you say to that?
Well, I would say I cannot see how that would be, how this could be taken away from that at all, because the reality is the quality sleep and the ability to get the kind of rest we need, we know that is one of our natural healers. We know that if we sleep, then our body can shut down and it can rest and it can start to heal the other things that we need. And so, you know, from an autism spectrum, you know, if your brain can turn off for a while and then you can bring it back to another time, then you're going to be more fresh and able to do things. I just think that in general with all these guys, with a normal population base that doesn't have the significant health challenges, no matter what, you got to get good sleep. We're not inventing this, and dentists aren't saying, oh yes, you need to sleep. I mean, everybody's been telling us we need to sleep forever. You know, have we always listened? No, but you know, I think that it can totally improve quality of life by having that good rest and then getting to a better spot. And you know, if we look at it from a purely dental perspective, we know straight teeth are easier to clean. We know straight teeth have better hygiene. We have less gingivitis, less periodontitis, less all these other problems and challenges that we see so often in maybe a subset of the population that has significant challenges in cleaning them. So, you know, if you have a child that you're like, wow, I can't even really brush them that well, and you know, now they're older and they're not listening to me quite as much as they were, and we're having this caretaker trying to do this, and they're struggling with, and they want independence with brushing their teeth, and we want them to take the independence to brush their teeth. Well, let's say they're straight as compared to really, really crooked. Oh my gosh, it's so much better. Let's say that they're breathing through their nose better and not through their mouth. Their teeth aren't dried out, their gums aren't dried out and brittle, and all the other things that come from this. So, you know, the reality is in general, it's going to help many different ways. You know, I mean, I think if we can get every kid to have straighter teeth, you're going to be less prone to decay. You're going to be less, you know, just from the natural things that are happening with that. And I'm not saying that you have straight teeth, you're never going to get cavities or any problems like that. You have to take, you know, some ownership on the other parts of it, but it sure doesn't hurt.
Okay, how many children have autism? I mean, if you're able to help with those kids, what population size are we talking about?
Yeah, I mean, you know, I think autism, I forget the prevalence for sure. I mean, we're talking in the you know, low 1 percentile, you know, something like that. Like it's point something percent of our population. That being said, you know, if you're looking out on a grand scheme and you have a population in a city of several, you know, thousands or hundreds of thousands, that's a lot of kids. And so I think that, you know, not every child is going to be able to do this. But specifically, if we talk to autism, and I am by no means a specialist on autism, but one of the things that we know is that you need to have things that are repeatable processes that they can learn, that you need to try to, you know, we're going to do this, then we're going to do this, then we're going to do this. And the kids that respond best, the kids that do that respond best to that kind of thing. So if we have a really, really set up, you know, environment where these things are just what we do, then that really helps them. This can totally fit into that, okay, we do this, and then we're going to brush our teeth, and then we put in your appliance, and then we go to sleep, and you do that, and you do that, and you do that, and you get, you set that expectation, and I think they respond pretty well to that.
Does it help to introduce it to them at a younger age?
I think so. I think in general, because, you can talk about the whole benefits of when it's happening with growth as well. So as far as how well the appliance works, obviously it's better when they're younger. I think that, for our special needs population, you have to have a little bit of compliance. You don't want to start too early to where you're really, really pushing it too much, and then we kind of burn them out on the concept of it. But you want to start early enough to where when they're at that spot, then you can kind of say, okay, let's try to start doing this. I will do that for all of our patients. When I see a 2 or 3 year old and I'm like, wow, they're having issues with sleep, they're having issues with this, and I can see this major malocclusion coming, we already start talking about it at that point in time, and we say, when we feel like they may be ready, this is going to be an option for them, and we might want to consider it. So the parents are already hearing about it, and when we come down to that age when they're like, hey, we're potty trained now, we were a thumb sucker, but we want to stop it, but we don't know how to. These are the kind of things where you're like, okay, that little bit of motivation is there. That child is emotionally, behaviorally a little bit more ready for that. Let's go for it. And I think that's that goes across everybody. You just have to see if that kind of ability is there within them.
Before I go to the general population, I just want to ask one more question.
Yeah.
Between the Down syndrome and the autism, which one of them is easier to work with?
I don't know. It depends. I think that it just depends on the severity. There's so much of a range. You can have a mildly autistic patient, or you can have the different, within your spectrum, you have, the whole Asperger's, condition as well. There's a lot of different things. And I think when you're talking about appealing to an autism spectrum patient, you're going to be looking at, how do you present it to them? Do you go at this from a very intellectual and okay, well, if you do this, then this happens, and this happens, and this happens. You can get very scientific with them, maybe. Do you get, no, this is just what we're going to do. We're going to do this, then this, then this, and I think the answer is yes, you do both. So you're going to have to see where they are on the spectrum and see what their home life is like, and see what they're used to in as far as approach. Down syndrome, maybe, depending on what their support system is at home, can be easier. I'm going to generalize a little bit. Typically, a patient with Down syndrome, they're usually pretty happy. They're usually wanting to please. That's kind of the nature of what comes along with that particular syndrome. I will not say that every single one is like that, but that a lot of times can be pretty helpful in this, especially if you start early enough. If you wait a little bit too long, then we know that when the teens time come, that jovial, good-natured, super happy kid sometimes changes a little bit with all the hormones and everything that happen.
Dreaded hormones.
Yeah, so that's a good question. But I think I think they both are doable. It's going to be patient selection. You're going to have to choose the right patient and see if they're ready for it. But my thought is, as long as you set your clear expectations with the parents and with the caregivers to say that we see this as a potential huge help for them down the road, they can do well with it.
Not many people have this experience, and so I appreciate getting one more doctor to talk about it, because
absolutely.
So many families are desperate. They say, anything, can you help me?
Right.
And they just see us as such a great alternative. All right, let's come back and to say, how did you get introduced to this? And, you said something about, from day 2 on. When would you ever see an infant? What's going on that you want to be alerted to? And just, your experience of being exposed to it.
Okay. So I came across this not, of course, at all by training in dentistry, because we don't really talk about this type of stuff that much. You just kind of gloss over it a little bit. In my practice, in my private practice, well, I'll take it back. In my public health experience prior to this, we had so much malocclusion, we had so much crowding, we had so many issues with all these things, and there was just this horrible, prognosis for down the road, because these kids were not going to get braces. They were not going to get orthodontics because there's no money in it, and they don't qualify for medically necessary orthodontic care. So that was very depressing, and we tried all these things all the way along. We tried extracting teeth and putting in space maintainers and doing some interceptive stuff, and really it wasn't comprehensive enough to really address it. So that I was very dissatisfied with the way that we were able to help that population. In my private office, once we had started here, I started noticing that as we were getting more and more families coming in with children where the main concern was, my kid is not sleeping at night. They are breathing through their mouth. I've been to the ENT. They said, it's not great, but maybe they'll grow out of it. They've been to the pediatrician, and they said, yeah, that's not great, but maybe they'll grow out of it. And everybody basically said, yeah, it's not good, but I don't know what to do. And so they'd come to see me, and I knew that we have some potential, and we've heard in pediatric dentistry, hey, we get some expansion in there, we're opening the arches, it sometimes helps with the sinuses and nasal breathing, et cetera, et cetera. But the problem is I was getting so many of these kids that while they would benefit from some expansion to open up the sinuses and everything, they weren't in cross-bite orthodontically. They weren't great, but they weren't so bad that I was thinking we had to do all this stuff. And so I was looking for maybe just an answer on what can we do in some of these situations. So then I come across the option with HealthyStart. And once I started looking into it more, I said, wow, actually this is a lot more comprehensive and a lot bigger than I ever realized that this problem was. And once we went to that first session, before that I was already pretty sold on saying that, okay, this is something that I need to take a whole lot more stock or consideration in, because I'm seeing all these kids. I see all these kids, 50 kids are coming in a day, and I'm seeing all of them, and all of them have these problems, and I'm not doing anything about it, and nobody else is either. And so I started to say, man, I need to own up to it a little bit more as a professional and at least give them some options for care. So once we started seeing that, and we started seeing what a lot of the research was showing us and what we could actually do to change these kids' lives, that's when we said we need to start this. So at our very first session with HealthyStart, I actually brought my kids down for the session, the patient time, and had them evaluated as well, because neither one of them are good sleepers. And they don't have horrible malocclusions, but they did have deep overbites, and they are crazy restless sleepers and mouth breathers when they sleep, and bags under the eyes, and all of the things that we had just talked about. That very first day we put my son in the habit corrector became a matter of the next couple of weeks, once he started wearing it, became a completely different sleeper and a much more rested child. He had never had, a lot of the specific things that we would say, he totally has attention deficit hyperactivity disorder, ADHD, but at the same time, was he more hyperactive? Was he having a harder time focusing? Was he, were we starting to see some of this? And yeah, and it does really come back to sleep deprivation. So we started looking at this more in the sleep side of it. As we started doing that, we started realizing how much it helps orthodontically. So we started rolling it out in the practice, and once we did that, it's almost hard not to have too much of it in the practice, because virtually almost every kid that comes in would benefit from this. But that's something that you have to discuss with the parents and the patients and figure out what's right for everybody, because not everybody's going to say, I'm going to go ahead and start my orthodontic treatment at 5 years old, although it would probably help.
Where'd you go to dental school?
So I went to University of the Pacific Dental School. We now, I believe, call it Pacific. San Francisco. Wonderful school, great clinical training, good exposure to a broad array of dentistry. We're really known to be one of the clinical strong houses of dentistry. We get great clinical experience. We didn't get a ton though of this, and I went ahead and specialized in pediatric dentistry as well, and so for that you do a 2-year residency. I did that on the East Coast through the Lutheran Medical Center's program in Providence, Rhode Island, which is actually now through NYU. Anyways, they taught us a lot about interceptive orthodontics. They taught us a lot about we did a lot of band and bracket full-on orthodontic cases. I think I completed within 3 years there, because I stayed a year as faculty, I did 20 cases. I mean, that's a lot of cases. But we didn't have this exposure as much. We knew that there was some stuff with functional appliances, and we tried just a little tiny bit of it. But most of what we had been hearing is functional appliances don't work. And I'll tell you my experience with functional appliances. I think that they do work, but if we don't follow up with them and we don't continue to finish the job, then yes, you're going to still need braces down the road. But say you start the functional appliances early on, and then you continue in some form of responsibly managing them down the road, then yeah, it can totally work, because as long as you correct the growth problems and you correct the habits that are causing those growth problems, then things will go the right way. And that's the funny thing that we're looking at. We're saying like, oh, well, they've got this crossbite, so we'll put them in this early appliance and correct the crossbite. Great. But we never corrected what caused the crossbite, or they still have a major tongue thrust, or they are actually tongue-tied, and we've never dealt with that. There's a lot of things that, because we never corrected what was causing the problem in the first place, how are you going to expect it to continue to grow in the right direction? What I love about this program is that we start to correct, we correct what the problem is. We correct that bad tongue position. We correct those tongue thrusts. We correct the habits and get the teeth in the right position. And then once they're there, the body wants to grow to the right spot. Our genes are telling us they want us to grow to the right spot. But if we give all these wrong, signals saying, hey, grow this way because your tongue's pushing over here, or, don't breathe through your nose, breathe through your mouth, and then let it grow that way, it's not going to work.
So you're talking about this treatment is comprehensive.
Yes, exactly. And that's the greatest part about it, is that, you start out in this, you get them kind of trained to go to the right spot, provide the space for things to come in. Once they're in, we don't have to have compensations down the road. You get those 4 lowers and 4 upper teeth in, you get a proper overbite overjet relationship, teeth grow straight from there. That's the premise of it, and it works pretty amazing. That's why you don't get relapse. You don't get things going back the wrong way, because they grew in the right spot from the start.
If I'm the parent and I'm listening to you, I'm believing everything you say. I have total confidence in you. You're very bright. You're very experienced. You've been teaching. You deal with children. So my question now is this: is there anything better than this?
I haven't found it, I'll say that. Because, the reality is, can you do amazing results with comprehensive orthodontics? Absolutely. I mean, orthodontists, I don't know how they pull off some of the results they do. But if we have the opportunity to not have to go through full orthodontics, if we have the opportunity to start it at the younger age when they're growing and correct things comprehensively, why would you not do that? I don't want to say that, this is the only way, because for some people feasibly it may not be financially an option, or maybe they just can't get, a kid to comply. But the reality is, I don't see how you could pass on it. If you have the opportunity to do this, it's the best way to go, because you are talking comprehensive.
And the way I'm looking at this from the outside point of view is the orthodontist always has a patient that is past the age where this is going to be effective.
Right.
So the best thing that we can do for our children is get them, and it's kind of an unserved population.
Right.
They're not getting the right care because
They're not.
you went to school.
Right.
Can you talk to the dental schools and say, hey, look,
Really.
you need to be doing this?
Well, that's the funny thing is, so what we learned in dental school, what we learned in residency, we totally learned what we're looking at as far as what the problems are. We're like, hey, there's not enough space in here. We can see this kid's going to be crowded. They have no leeway space. They have no this. They have no that. They've got this deep overbite, overjet, and you write it all down in a chart, and you say you're probably going to need orthodontics. And then, sometimes you say, hey, let me send them to the orthodontist early, because, we've heard that, every kid should go to the orthodontist. I think one orthodontist was telling me around 7 or 8. And so we send them to the orthodontist, they're like, yep, I do agree, they're going to need orthodontic treatment, but I think we're going to wait for now.
Exactly, come back. They put them on the
they come back
recall.
at 12. So, my thought is, if we have the option of doing something right now, and we can end up having a great result, I don't know why we wouldn't do that, because that's what it's all about. Get it done early, and especially in the light of what's happening so much now more with the sleep, and so much now more with airway and development, growth and development just in general. We can move teeth down the road. Of course you can. You can push teeth through bone. You can. We've seen it for a long time. But we can actually get the jaws and the teeth to the right spot right now. Right now by 8 or 9 years old, they're pretty much there. And if they just keep on growing regular from there on out, then they're done.
Yeah, I've heard so many cases where people say, we did everything that we were told to do,
Yeah.
and they did fix the teeth, but there was relapse, and they
Yeah.
never fixed all the
Right.
breathing issues, so now
Right.
they can only hope that Band-Aids will get them through life.
Well, and that's honestly, I look at my own perspective, and granted, I had a challenging orthodontic case. I had broken jaw when I was in second grade, and this and that. So things are off there. But the reality is, I'm not satisfied at this point in time with my orthodontic treatment, because I know that yes, they took out molars, took out a bicuspid, made the teeth look straightish, but I've got relapse. I've got TMJ issues. I've got not a flat occlusal plane. I still have a little bit of tongue thrust unless I consciously think about it. And all these things aren't helping, and unfortunately it is too late for me. And so, therefore I get to be the kid, or not a kid anymore. I like to be a kid at heart, of course. But I get to be the guy that has those issues with sleep, and comes from a family of seeing that I have issues with sleep. Have a dad who's a dentist who is crazy into the sleep part of dentistry, who's doing amazing things for his patients, and largely came out of it because he realized how big of an issue it was for himself. But we know, and we've talked a lot about this, we know that if I get to these kids early enough and we start affecting it right now, then we don't have to go down that road at all down the road. And so that's the amazing part, is that we can affect that health and the overall longevity of how that kid is going to be when they are 25, 35, 45, and then on up. They're not going to endure the same problems that we've had to do, because we had one mode of treatment that maybe didn't end up going the right way.
I think about Dr. B as a world changer, and could anyone argue that?
Yeah, no way. The reality is the things that he's doing for so many of those patients, and you look at the cases that he's done, and you look and see, wow, he took that from there to there, and this kid only had to wear this thing at night, just those first things, and to look at the different appliances that he's been able to get these people in, and to see the changes in sleep right from the very start, before anybody talked about it. He was already kind of getting those side effects of treatment, and that's amazing. So,
all right, we gotta stop. Dang
yeah.
it. I know.